Thank you, Chairwoman and Ranking Member, for this hearing. Thank you all. I think we're done. You pretty much said everything that we need to get started on. But let me say this, because I think you touched on this, Ms. Woods-Flowers, and that's this. It's the idea that this act that we were talking about, the BOLD Act, really sets the tone that this is a public health crisis, and we are creating an infrastructure that is necessary for that coordinated care plan that we have all been talking about today. That's a coordinated plan that we can tap into an infrastructure to address everything. And I say that because I just came back from Nevada, and I know there's Nevada folks here as well. And we had a roundtable discussion in Northern Nevada, and I had a lot of my stakeholders at the table to talk about where are the gaps, where do we need to work together? Because I will tell you, in Nevada, we have a state aging division. They're phenomenal. You do an incredible job, incredible job. And I so agree with you that now is time to coordinate and connect everybody together because of what we just heard. And Ms. Gayharden, I am going to touch on this. One of the gaps we have is the doctors. Not that they don't want to be there, but they're not trained to think about this when you first come in and there's an early diagnosis or detention to connect you with the services that you need in your community. That is the number one thing that I heard from the folks in Nevada that I was sitting with. How do we bring them in? And then you brought in the first responders. It's the same thing. So by creating this idea that this is a public health crisis, we have an infrastructure that now we can all tap into and start education, start early diagnosis, start the detection, and then start the help and assistance that's necessary for everybody to tap into it. That is the key. That's what we're trying to achieve here. So I so appreciate the questions and the comments that you had today. Let me touch on one area, which is the data collection, which for me is key. I'm a data geek, and I think that's where everything starts, is collecting the data, and we learn from the data, and it takes us in directions that are so important. But one of the things I'm particularly concerned about when it comes to dementia-related health disparities is those that occur in our communities of color. American Indian and Alaska Native communities, LGBTQ communities, and people with intellectual and developmental disabilities. So, Dr. McGuire, let me ask you this. Can you tell me what kind of health disparities the CDC's data collection has already discovered?
Thank you very much for that question. Through our behavioral risk factor surveillance system, we are asking people to evaluate their own memory performance. We call it subjective cognitive decline. And we also ask caregivers about their specific caregiving situation. So we know 1 in 9 Americans report that their memory has worsened in the past year. And we know about 1 in 4 Americans is caring for a loved one or family member. So to answer your question, we do know disparity-wise, we do know that we see higher numbers of individuals that are African American that are reporting the subjective cognitive decline, also individuals that are Hispanic, Latino, and also American Indian, Alaska Natives. Through our work, we are working with some tribal organizations to increase awareness in tribal communities and to really try to think about risk reduction. So we have some messaging campaigns that are being developed about managing your blood pressure in middle age, because we know that managing your blood pressure in middle age can help reduce your risk of having dementia later on. And we're developing those messages for tribal communities, for the providers, and for the general population as well.
Thank you. Is there anything that we have not talked about today? I'm going to open up to the panel, where you see gaps or other challenges that we should be focused on.
I think there's gaps in teaching our young people about Alzheimer's and how their diet and lack of exercise might be a precursor to ultimately the systems. I talk to my kids about it, and I guarantee you, I go, oh, Mom, we got to clean out the pantry. But they're interested in it, and they're changing their own diets. And I think I heard you say, Doctor, that mice, no matter what they ate, did you say that if they were exercising, they weren't showing signs of dementia? And so I thought that was just a really fascinating bit of information. Apparently you have to sweat if you exercise, which is not so hot in my opinion, but I'll do it if that's what it needs to be done. So I think education for the youth, I mean, the young ones, really, middle school, elementary school, because they're eating lots of sugar.
Right, thank you. Anyone else?
Yeah, I'll just expand on that. So the challenge with exercise and diet is that, you know, under controlled conditions, a strain of mouse does not get the same degree of aging in the brain as those that don't exercise. Challenges in the human population, we know very little about how our genetics might interact and change the way in which exercise might be important. When I talk about my exercise research, I often get somebody stands up and say, well, my father was a marathon runner and then developed Alzheimer's at the age of 60. And so sadly, it's not simply exercise and everybody will be fine. What we can do using both human studies and animal model studies is to really understand how the genetics interacts with the environmental factors such as exercise, such as diet, in order to reduce risk. What I think is really important, though, is for sure, as a population, as societies, it's going to help. We can't predict who it's going to help, but overall it's going to help. It should reduce numbers, or it should reduce the incidence of Alzheimer's disease. So the more we can do to encourage our children, you know, and older to get out there and do some exercise and balance their lifestyle is going to be important.
Thank you. Thank you all. Appreciate you being here.